to make this video because I wanted to support the team in El Paso who've done so much for me. But also, if there's anyone out there was in the position I was in a few months ago, searching around on the internet, trying to find some solution for my hip arthritis, I just want to assure you that you're in the right place. This, right off the bat, I just want to say that this online program from El Paso Manual Physical Therapy is terrific. And now I'd like to tell you a bit about why I say that. About a year ago, I was on the tennis court and we played a little longer than normal. And when I got off the court, I was saying to my partners that my hips are killing me. The pain eventually subsided, but when I was under physical stress, I would get flare-ups, and eventually I decided I just had to quit playing. So the pain kind of migrated from my groin area, or to my groin area, and the upper inner thigh, which is the adductors. And apparently this is a fairly common symptom of hip arthritis. So climbing stairs was difficult, walking any distance was difficult. I started limping noticeably. Eventually I had to start using a cane to go upstairs. So I live on one of the smaller islands of the Bahamas, and we have limited medical facilities and resources here. I imagine some of you may be in the same position, whether you're in the Caribbean or in rural areas or where your medical resources are limited. So I had to fly to the capital city. I went to see a doctor there. She sent me for x-rays. The x-rays confirmed that I had mild to moderate hip arthritis in both hips. So because I live in a relatively remote area, I'm a huge fan of YouTube. You can find instructional videos on just about any subject. And I'm also a big believer in physiotherapy to fix medical problems. So I started watching a lot of videos, and I tried a lot of the exercises they were suggesting for hip arthritis, and nothing really helped me too much. I got a couple of problems in doing the exercises. When I started searching, I didn't have hip bursitis, and then I think I did a couple of the exercises improperly, and I eventually developed bursitis in one hip as well. So I wanted to persevere, however, and I started watching more and more of Dr. David Middau's videos. His theory on muscle imbalance made logical sense to me, and I knew that my own glutes had deteriorated drastically over the last 73 years. So I thought I'd like to give this a try. So it became clear to me that I needed a little more direction. I needed to know exactly where I was at, what exercises I should be doing, how often I should be doing them, just how to progress out of the stage that I was in to try and improve. And the majority of my friends wanted me to get a hip replacement, but for three main reasons I didn't want to do that. The first one was the cost. I don't have medical insurance that would have covered that type of surgery, and a little research showed me that the surgical costs alone was between $15,000 and $80,000, depending where you went. And that was just for the surgery. There wasn't any travel costs, any airfares, any accommodation, any medication, any follow-ups, whatever. So, and if I had to do two hips, that was really going to be an outrageous expense. So the second reason I didn't want to do it was because although hip replacement is fairly commonplace these days, it's still a surgery. They still open you up, they still cut your bone, they drill into the bone, they implant a foreign object, they sew you up, and they hope you don't get an infection. So although the risk is low, there's still a risk, like there is with any surgery. So, and thirdly, if the muscle imbalance was the problem, or the root cause of the hip arthritis, everyone I'd spoken to who had the hip surgery had to do rehab after their surgery. So I'm thinking, well, if you have to do rehab anyway, why not do the rehab beforehand and see if you can avoid the surgery altogether? So I made the decision to sign up for the online program at El Paso Manual Physical Therapy, and I'm really glad that I did. It cost me a few $100s, some time and effort, and it's really been well worth it. I figured I'd try it for about a month, and just to see how things were going there. But within a few days of trying it, I knew that this was going to work. This is in the right way. The trajectory of improvement improved quite a bit. So I know that everyone heals at a different rate, and there's a lot of factors involved in that. I'm sure one of them is the commitment to the program, but I found that I improved about 10% a week. So after 1 month, I figured I was about 40% improved, and I was thrilled with that. However, I thought, well, let me try another month. So I did another month, and that's where I'm at right now. I'm in my 7th week, and my rate of improvement has maintained that level. I think I'm 70 to 75% improved from what I was when I started. So I'm not quite ready to get back on the tennis court yet. I'd like to be 100% or close to it before I do that, but now I believe that's achievable. I think I might get there. So my strength and range of motion have increased dramatically. My incidence of pain is way down. Occasionally when I get a flare-up, or when I exercise too much during the day, I'll get a little flare-up. But it doesn't take as long to recover as it was. So I'm really happy with that. So that's my story. I'd like to just tell you a little bit about the team at the El Paso Manual Physical Therapy. They've been fantastic. They're totally committed to the belief in their program. They educate you. They encourage you. They advise you all the time. They're available way more than I thought they would be. Dr. David and the recovery coaches they're just totally committed. They go above and beyond, and I couldn't be happier with the way that they handle you. So I'd like to thank them all, especially my coach Rao. I believe enrolling in the program was one of the best decisions I've made. I'd recommend it 100% to anyone else who's watching. So unless you happen to live next door to the El Paso clinic, I think this online program is the way to go. You can save thousands and thousands of dollars in trying other treatments. So I've just one word of caution. On the weekly group chats, I've noticed that almost everybody is a senior, with a couple of exceptions. But by this stage in life, you know yourself pretty well. And if you be honest with yourself and say whether you need in-person, hourly or daily coaching, somebody to stand there with you while you do your exercises, then this program might not be for you. However, if you can commit to doing your own exercises because no one can do them for you. Do exactly what they say when they say to do them. I think this program will be beneficial for everyone. So that's my story. I hope it helped you with information and deciding how to proceed. And I hope you're all as successful as I was in this program. And best of luck to you.